Imagine a 30-year-old man who has had a little girl, starting a new family and a new chapter of his life. Unfortunately, he has a muscular disease called type 1 spinal muscular atrophy. This is a disease that kills motor neurons and muscles, leading him to a life of pain and suffering while his limbs slowly go into paralysis. He will spend every day in a wheelchair, unable to walk, although he's lucky in so much that most people with this condition only live to be around 20. He spends all his free time with his daughter, engaging in activities he is able to do. He wants to be normal for his little girl, be able to play as fathers do, and be with her as she grows up. A cephalosomatic anastomosis is the only solution that would likely restore his extremities that are slowly going into paralysis. That is to say, he needs a head/body transplant. Many people in the world are living with conditions just like his, having to fear when their last day is. The only way to save these lives is with a head-body transplant. No doubt, the thought of the surgery may bring thoughts of the old tale of Frankenstein, the guy who was made of body parts, sewn together into a man, and cast away by all. Which should have us thinking, is this wise? Is this possible? Well, don't think for too long, because with advanced technology in medicine, the thought of a cephalosomatic anastomosis is not very far away. The idea of this surgery may have us squirming in our seats, and that's understandable. The ethics and morals are such that they should cloud our heads. Issues like consent of the donor body and using organs on a surgery that could have been used for multiple organ donations instead are controversial topics. These topics have to be debated and certainly will be before any transplant is performed. But today I'm going to focus on the technological possibilities, so let's dive in. There are many things that come before surgery, starting with the perfect donor. This will be somebody who is brain dead but has all other bodily functions working. They will have to be the same gender, body type, and around the same age. They also need to make sure that the recipient isn't sensitized to donated organs through previous exposure to other tissues, and the donor and recipient need to match up to 6 biological markers in a process known as tissue typing. After hearing all these challenges, finding the perfect donor body is much harder than finding a heart or lungs and will be statistically unlikely, though not impossible. Another factor starts previous to surgery is therapy. Throughout this surgery and the healing process, there will be a lot of therapy needed for not just the patient, but family and friends. Therapy starts by having the patient who is receiving the body know and be able to accept the risks of the surgery, which includes the very considerable chance of death. Once the patient is aware of the consequences, this medical breakthrough can begin. This procedure starts with 2 medical teams, 1 for each patient. The teams would have 5 surgeons on each, and the procedure would last around 18 hours. This surgery starts by inducing both of the bodies into hypothermia to reduce blood flow so that exsanguination or death by blood loss cannot occur. The donor body is put into a normal medically induced hypothermia at around 18 degrees Celsius, where blood flow can slow down in the body, creating easier attachment to the recipient's spine. The recipient's head is put into profound hypothermia, which is around 10 degrees Celsius. The profound hypothermia allows for all blood flow in the body to be stopped for hours on end without damage to brain or any other nerves. And finally, the cutting starts, starting with the donor's body first. The first incision is made anterior to the cricoid cartilage, which is just behind your neck. After cutting through muscle, this will expose the common cricoid cartilage, the internal jugular vein, the vagus nerve, the peripheretic nerves, and then after this, the trachea, esophagus, and thyroid gland are exposed and cut between the C5 and 6 vertebrae. The clavicles are cut around the sternum, leaving the thyroid. After this is done, the same type of incision is done posteriorly to the cricoid cartilage on the recipient body. The clavicles are cut around the sternum again, but this time removing the thyroid gland. This cut is more in depth, carefully severing the internal jugular and the subclavian veins. They dissect the recurrent laryngeal nerve carefully because without or damaging this nerve will cause problems with speech. Lastly, they cut the spines of the patient and donor. They are cut at the C5 vertebrae with a special diamond blade that cuts a perfectly straight line on both patients. They will reattach the spines with a fusion called polyethylene glycol, or PEG. PEG is a chemical that can reverse apoptosis or cell death. It is approved by the FDA for organ transplants but has never been used on a human spine. Studies with canines, mice, and monkeys showed positive outcomes, and in even mice, PEG was proven more effective than a spine or nerve graft. In canines with spinal injuries, when PEG was used, motor function started to come back in days, where without it, it took months and sometimes never came back. You may be thinking, why haven't I heard about this? Well, PEG comes with its limitations. It can only be used if the application of the chemical can be done 1 to 3 hours after the spine is severed, and most spinal injuries take months or years to get surgery. Another factor is how the spine is cut. In most spinal injuries, the cuts are jagged, and PEG doesn't work effectively unless the cut is semi-straight. Sounds like a cephalosomatic anastomosis is the perfect scenario to use this chemical. The PEG is applied with 4 screws that will hold the spine together while it is healing. After the spine is attached, it will be time to sew Frankenstein back up. All veins and nerves will be anastomosed with a graft. The esophagus and trachea will be put back together using continuous sutures. Lastly, the muscle and skin will be hand sewn back together. Although opening and closing the head takes the most time, it is the easiest part of the surgery and can be compared to any type of limb transplantation. Then, the patient will be put into a brace, induced in a coma for 3 to 4 weeks to ensure PEG efficiency and make sure that the spine doesn't move while the chemical is fusing. Oh, thank goodness that surgery is over. But that doesn't just stop there. After the surgery is done, the patient will have to be getting IV immunosuppressors so that the brain won't attack the new body or vice versa. What's tricky about this is the dosage. When performing a cephalosomatic anastomosis on monkeys, the surgery was successful, but what killed the monkeys was that they were given too many immunosuppressors, which eventually led to an infection that couldn't be fought. Too little in your body will kill itself, or too much in the outside world could kill you. Because this has never been performed on a human, complications of the surgery are unknown, and medical professionals will treat the issues that arise. Another factor that was in pre-surgery is again in post-surgery, therapy. This time, the patient will not just be getting emotional therapy, but physical too. There isn't a time frame for the healing after the surgery because it's never been done. Physical therapy starts with starting to talk and eat and relearn all the simple things in life, but eventually the goal will be able to function normally. Emotional starts by readdressing that the patient could never get better physically and learning that every step of this healing process will be hard. Issues like appearance will need to be talked about because scars will be noticeable from surgery. Will people accept Frankenstein as the medical breakthrough or the castaway like the book? Although this may seem far-fetched and crazy, changing lives like these is even crazier. Throughout this talk, I've shown that a cephalosomatic anastomosis is possible, although there are many areas that can have mistakes. Improving the quality of someone's life always outweighs the risks. This surgery, if completed successfully, will be a breakthrough in medicine and change many lives. Thank you.